a meeting with the different stakeholders and the government, Council of Governors, to ensure that these workers who are actually our frontline soldiers are well taken care of.
There is no denying that a strike at this time will paralyze operations in public medical facilities already reeling from the soaring number of infections. Eunice Omolo, NTV.
Very sad state of affairs considering the times we're living in. And Dr. Bosire, as a frontline worker, we first celebrate you for what you're doing for us and on our behalf. And what is your feeling even as you face this pandemic in the current circumstances that have been put across by other health workers?
To be really honest, I am anxious and my anxiety just is reflected across the board. I am tired. I am heartbroken that over the weekend we have lost yet another healthcare worker who had just delivered a newborn, Marianne. She's a nurse in Homa Bay. And I don't think the gravity of COVID has really hit home until when we lost Adisia. You know, when we kept saying that protect us, the only way you can protect me as your doctor is to be able to ensure that you're safe. It's only now that it's hitting home that even those of us who have been tasked to be able to keep you alive on ventilation, on medication, to ensure that even when you are critically ill, we are there until we start dropping, until we get isolated. As you've seen, the last 1 week, we've had some of our senior colleagues being isolated. That's when the reality is hitting. And even when this reality is hitting home, we think very little investment in protecting us, to be very honest, right? We've been thinking about PPE since February, since March. We're still thinking about PPEs until now. It breaks my heart every single day to read headlines where there is misappropriation of resources for COVID. There is PPEs that were supposed to get to frontline healthcare workers, never got to frontline healthcare workers. It became a business for individuals, and then you still expect me to show up as your doctor. How? And yet I'm bound to doing no harm to you. I'm bound to ensure that I preserve life. And yet I'm human still. I am a mother, I'm a sister, I'm a member of the society. And my community still needs me. How am I supposed to do my work when I cannot do my work well because I'm unprotected? I'm an anxious doctor on behalf of the other healthcare workers also.
Okay, now, Dr. Bosire, we hear you and feel your pain, and I am sure you speak on behalf of very many others that wake up every day to cater for Kenyans at large. And Lois, just listening to Dr. Bosire, I mean, at this point, I think it is very clear for those that are forgotten that doctors, nurses, other, healthcare workers are just as human as we are.
Yeah, I think Gladys, Dr. Bosire is raising a very, very critical concern, and I'm part of what we call the debriefing of healthcare workers, and actually it overwhelms. It even overwhelms us as the people who are supporting them emotionally, and you can hear the pain and also the reason why they are actually being put. Their vulnerability is dependent on some selfish, somebody who is not taking care or taking responsibility. And that's a fact. And some of these things now, we've just got to be candid about them. Because, you see, if you're not protecting someone who is literally, like what Dr. Bosire is saying, they are literally walking into the valley of death. But there's a way in which they can protect themselves to reduce the anxiety. So most of the healthcare workers are overwhelmed. Remember, they are coming from those hospitals and they also have families. Yes. And these families are also anxious. We're already handling even children who are almost afraid. It's like they see their mother, they see death. They see their dad coming from hospital, they see that. So a child develops again now a panic disorder simply because this person is putting their life on the line to be able to save someone and to be able to work according to what the oath that they have taken. So it's, I think the situation is extremely critical. But then what really concerns me as a psychologist and also as a spiritual person is the lightness, you know, the carefreeness with which we are taking, you know, this whole scenario. Because it's a simple thing that we are supposed to do, but then most of us are taking it just for granted. Yeah. If we were to do something greater than a mask, than social distancing, than washing hands, you know, we would say it's costly. But now it's something that each one of us can be able to do. I usually say the soap does not matter. The quality does not matter. Soap is soap. So we are still a bit carefree. And when you watch people talking about it, I mean, Kenya, it's good, it's humor, gives us a way of coping. But when we take it overboard, when we need to take personal responsibility, then we are really endangering some people's lives.
Okay,
Yeah.
and just to drive this point home, Dr. Chibanzi Mwachonda, the Acting Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, tested positive for coronavirus last week, and he is currently stable and in self-isolation. And this is just another case that brings to the fore that our health workers are also as vulnerable as you are. Dr. Bosire, back to you again. Lois has talked about coping mechanisms despite and in spite of everything. How are you coping with your reality?
So one of the things I'm really grateful for is my social support system. I'm really grateful for my girlfriends. I'm really grateful for my family because like this week they've taken TJ, my son, away from me. So I am going to spend a lot of the time just introspecting and thinking about lots of things that are happening around me. I am also dancing, right? Something I haven't done in such a long time. I am discovering, like, you know what, I can be able to find other means and ways of just forgetting that I'm a doctor and just bringing the life out of me. And the other ways in which we are trying to also build social networks within my support system, who are my colleagues. So we constantly check on each other. We are Zooming, we are WhatsApping. I think this is the most I've ever been on social media for a long period of time, because I keep checking on what's happening beyond medicine, what's happening outside there in the world, because then it keeps us sane. The other thing also, as we are also debriefing, and the Kenya Medical Association, together with other partners, have put up this fund to be able to support healthcare workers in debriefing. We have psychologists on board. We're working with the Association of Psychologists, and it's really, really helping us a lot. Despite that, we are trying to survive. I mean, it's this is actually moments of survival, and but the biggest and the most important thing is that we are grateful for the Kenyans who are doing what they can be able to do to keep us safe. Despite the fact that we are saying a bigger number is not doing, I mean, a huge number is not really focusing on the public health interventions. We appreciate those ones who are keeping to the latter, the public health interventions that the government keeps speaking about: social distancing, hand hygiene, even those who are taking vitamin C. We are really grateful for that, and we are encouraging that. In fact, a colleague of mine and I have been really advocating through the hashtag The Cure to be able to ensure that people are able to become their first physician, so that by the time you're brought to me, can you be brought to me when you're critically ill or when you cannot be able to take care of yourself at home? So we are encouraging home-based care. We are encouraging people to be able to see doctors or nurses from their comfort of their home, so that there's very little interactions with the rest of the public, and there's a reduction in the risk. And Gladys, this is a reality also that we have to live in. And the reality is around what is this COVID teaching us right now. And as a healthcare doctor, one of the things, aside from seeing COVID patients, the other reality for me is the neglection of the other diseases that are happening. I mean, we still have our hypertensive patients, we still have our diabetic patients, still have our asthmatic patients. And because of the fear and the stigma around COVID, which we must also deconstruct, because while it's a dangerous disease, it's fatal, we have to tell the public that 90% of the people are walking out alive, 90% of people are surviving, right? So we must be able to tell people there has to be some connotations around hope. So hope is one of the things that will keep us alive and will make us survive this whole time. Yeah.
I hear you, Stella, and we'll definitely be coming back to address the stigma involved in this pandemic. And at this point, let me bring in David Kingatua. Now, as I said, you're not only a businessman, you're a husband, you're a father of 3, and your youngest is actually 3 weeks old. How are you coping in this season?
Oh, thank you very much, Gladys. I'm glad to be in this panel. Well, it's been tough. But the birth of my third-born child has brought joy and has brought some excitement into the family that we are glad and happy to enjoy. But financially, spiritually, as Dr. said, and socially has been our biggest challenge. I am a very outdoor person and very social and extrovert, and not being able to socialize has been a huge impact. And also considering that I'm in the event space, we are not able to, our industry was the first to be hit. I remember just before the measures came out by the government, we had a huge conference that was cancelled 2 days to the event. And I mean, it was a huge blow. It was economically, it has just shut us down. We have not been able to make any money. So it has been very difficult in terms of just moving around and just handling issues here and there. So it's been really tough, but at the end of the day, we still have hope.
Now, definitely for the men who you represent at this point, there is that pressure. You're the provider of a family. The social economic status has really been hit, as you mentioned. How then do you cope with this kind of pressure?
Wow, it's been very difficult, and especially for men. I know many men who are really struggling and are really going through a rough time because men are known not to share stuff, are known not to open up to. They don't really have a support system, but I am grateful because I have a group of men that I work with, and we have been doing this for the last 7 years, and that support system has been very critical in my journey during this time because we're able to share stuff. We are able to be accountable to each other, that we do not fall into things that are not right. We are able to support each other. We are able to stand with each other. If someone is really stuck, we're able to chip in and share just what we can, and to be able to stand with each other. That has been a huge support system. But most men do not have that support system.
I hear you. I hear you.
This time is when you realize that, sorry.
Okay, now I hear David loud and clear, and I'm sure most men are saying we hear you too. When you are dealing with a man, what are the pitfalls that you have seen, especially in this season?
I think, Gladys, it's important to note that just when Corona hit, I deal a lot with relationships. We were not at a good place in terms of the family cohesion, family relationships, and there was a bit of pressure on materialistic, that men provide this, and everybody was looking at, I have this car, I'm moving into this, they call it hood, we are doing stuff, we are going for holiday. That we were actually at a hype. And a lot of relationships were hurting simply because, people are expecting a bit too much in terms of material provision and investment. Now then Corona just came and hit. And you can hear what David is saying. Some of them were in what I'm calling very, very subtle, places of work. And they were just shut down. There are people whose lives have been shut. There are those who have been slowed. There are those whose lives have just been interrupted. And there are also those who have thrived because of Corona. Now, what I'm really glad about, and it gives me a lot of encouragement, is that more men are reaching out. And I'm actually here having more of men than I've ever had in a long time calling in to just ask Lois, can I come? And then can I come with my wife? And we've also had to scale down. Personally, I've had to scale down even the fee and sometimes even give my services free. And I'm glad, like Dr. Bosire mentioned, and David also mentioned, that I've allowed, and a number of our psychologists have allowed ourselves to be put in those groups that they are forming, just for us to be able to give them the professional support, let them know what they can do at a personal level, even when the external forces are not working for them. And I hear what Dr. Bosire said. Dance, the physical aspect of it helps to remove anxiety, to stress. Then you have to deal with the external issues. So there are certain things, they could be funny, they could be interesting, but it's a time for us to just do what we need to do to survive. Survival is key at such a point in time. And even if it means reaching out, moving out of the ordinary, and particularly in the support systems that we are having, people have just got to realize that shame and guilt and everything else is no longer an issue. But we've just got to move and shout out for help when you feel you cannot help yourself.
Okay, and let's bring in Sydney Chazima. You are a young man, a creative. You once worked here at the Nation Media Group a while back, and now you call yourself Baba Mboga Deliveries. How did this transition happen, and what orchestrated the same?
Thank you, Gladys. Glad to be here. So first and foremost, after I left here, I was contracted by high schools in Kenya, where we train students to do these contemporary cultural dances and take them to festivals, the drama festival, which happens annually. So you are employed by the school. Now this year, we had practiced, and we went to the competition just around March, and that's when the first case is being announced. Yes, we have a coronavirus case in Kenya. Then all of a sudden, everything is held. People are going on stage to perform. Everything is stopped. You're told to wait until you make a decision. You go outside, you wait. Then finally they decide, we have cancelled everything. Everything is shattered. If you are not being paid by the school tells you you're on contract, you don't have money right now. So you go home with the expectation that everything is going to come back to normal. But it has never come back to normal since then. So you sit at home, and at the same time, I'm a creative. I do videos on YouTube and Facebook, and I also edit videos. But around that time, there's nothing that is happening. You sit with your phone like for a whole day, no one is calling you, no one. So there's a friend of mine, he's called Steve. He used to send me groceries. Every day he tells me, you live near a market, so you go buy me those groceries. He sends me a big package. So one day I'm going to the market, I'm asking myself, what is this I'm doing? Why can't I do this thing on my own? So that very first day he sent me, I took pictures of the groceries I had bought for him and posted them online. And I got a very huge reaction from people, and that's how I started in. And that's how the name Baba Mboga Deliveries came about.
All right. Now, as you hear Sydney saying that he's a creative and he's have videos online that really make many people laugh as he mimics people. And this is one of his works.
Mimi nawaambia kitu kimoja peke yake, ya kwamba wagojee miaka 10 Uhuru amalize kazi yake, alafu wagojee miaka ingine 10 Ruto amalize kazi yake.
Well. Throwback Thursday came very early.
Hii kijana anaitwa Ruto, unajua kila weekend anatanga kila pahali.
But things have escalated quickly to this.
William Ruto and his allies are promising President Uhuru Kenyatta a battle as the duo of Elgeyo Marakwet Senator Kipchumba Murkomen and Nakuru Senator Susan Kihika insist they will hold on to their leadership positions even as their offices now have new occupants.
As it seems, Babangina's change of mind is not going down well.
About 20 people met in State House to plot out to remove Murkomen. Mr. Speaker,
One Kipchumba Murkomen is not having any of this.
Mr. Speaker, the president is already a big man. I am just but a son of a squatter, born and brought up in Embobut. To be a subject of his discussion over and over again, I want to say, Mr. President, now therefore deliver for the people of Kenya. Murkomen is out of the way. If I was your stumbling block, deliver for the people of Kenya.
When your goose is cooked, you sit down and wait to be served. Isn't it WSR? In the book of Revelations, it is said that man shall not live on bread alone. Hii ni mambo imeandika kwa Biblia na tutapita. But wait, what does Baba have to say? Mambo ya Jubilee sisi hapana ingilia. Sawa. At the end of it all, matters were left in the hands of KLM to decide. And did he decide?
I wish to communicate to the House that the majority has effected changes which shall now take effect as follows. Senate Majority Leader, Senator Samuel Bogisho. 2, Senate Minority Whip, Senator Irun Kangata.
Wakitaka watakuja sasa waunde yao ambaye watakuja kusema ni nani atakuwa ndani, nani atakuwa nje. Hiyo ni yao wakati yao ikifika.
Mambo ya Jubilee sisi hapana ingilia. I'm Anuel Juma, Bullseye, NTV.
A mimic there of our very own Emmanuel Juma for Bullseye. And clearly this is something that you are talented in doing. And then you shift to Baba Mboga deliveries. What are some of the challenges you've been dealing with apart from being told una umama?
Wow. First of all, I'm a young guy, and most of us, we are online on Facebook, on Instagram. So the moment people see you selling vegetables, you are killing your street cred. There's something you say, your gangster points is in a shuka. Yeah, so you imagine, you immediately start selling. There are those who will tell you, hey, Maze, what are you doing? Ini umama, unajua. But you forge on. You imagine, you used to have nothing in the pocket, but now you're constantly afloat with something. So will you listen to them or you keep on doing your thing? Then another thing is, this business requires that I have to deliver to your doorstep. But there are people who feel like I have to pay the delivery fee. I can just get it from here. Or you insert a delivery fee, they'll tell you, ini mingi sana. That is one of the major challenges. And then there are those ones who usually just wake up and tell you, Baba Mboga, ebu nilete groceries kesho, ama leo saizi. And you know, for these things you have to go to the market at 4 a.m. 4 a.m. daily, so that you get the favorable prices from the real farmers. Because once you get to the market around 7, you are dealing with the middlemen who have already hiked the price. So that is one of the major challenges.
Okay, now just listening to Sydney, a young man, and representing very many young people who also have had to readjust to the new reality. What are some of the things that you have seen they're struggling with, and what would you suggest going forward?
I think, like I mentioned, and it's coming out clearly from Sydney, is the issue of feeling ashamed and feeling shy, and maybe, you know, listening to people who I talked about. There are people who are okay. That's the reality of it. And when you listen to them, or some of them are not even okay, but they are trying to push other people because hurting people hurt others. No matter what good someone is doing, if the person is hurting, they would always poke at the other person's efforts and anything that they're doing to survive. So as we speak now, it is a time for survival. You know, the first 1 month, we actually thought, and in the spiritual world, we actually really prayed, let Corona go away. But it didn't. The second month is here with us. We are 5 months down the line, Gladys, and it appears like it is going to be a while. So we are getting into a survival mode where people have got to survive because as much as others were still holding on and some employers could still pay 50%, they've moved to 40. They will be going to 20, and then they will go on those unpaid leave. So people have to survive. So one of the things that no one can afford now is to start feeling ashamed of anything they can do to get food on their table, feeling like listening to too many people.
Wasichague kazi.
Listening to too many people concerning what you're doing to keep afloat is a real danger. So there's nothing that someone cannot do as we speak now. Yeah. I remember somebody said, look, someone was actually scorning at someone, parking a nice vehicle and selling vegetables from it. And someone mentioned and said, let me even buy vegetables from this expensive car. Let me leave these other ones for now. I'm just buying it so that I see how vegetable from this kind of a car is. And as much as that is happening, but the person who is doing this, they know where it hurts. They know that they must survive. They have a 3-week-old baby. Some of them, like Dr. Bosire was saying, they are taking care of patients with other, lifelong conditions, and they must survive.
All right, so let's bring in Sophia Wambui. Now, when people are talking about, the huge shift in their lives and mostly the loss of incomes, the loss of jobs, the loss of businesses, these are shoes that you have walked in for a while, and thankfully you were able to find your way. Could you touch on that and some of the lessons now in retrospect that you got for a time such as this?
Morning, Gladys. I hope you can hear me. Yes. Thank you for having me. Yes, I have walked these shoes for some time now. I lost my job in 2015, arising out of a redundancy or a restructuring as it was. And so, COVID hasn't really necessarily shocked me that badly because I'd been having a bit of a hiatus myself. But I've had to readjust in terms of getting more spiritual. I certainly have had to do that. I drew closer to God in that season. So by the time COVID was hitting, I think I kind of had my spiritual footing. Regarding business, I got into that after losing my job, and that definitely got hit now by COVID. But even in 2019, I guess I may have been prepared for the downward trend because I had to also take a little hiatus from that because I had a major surgery. So ultimately, I think I've felt a bit of a steady move into this current season we are in. Not to say that it's been easy throughout. It certainly just had me to readjust a lot of things in my life. Yeah.
Okay, and definitely a lot of adjustment and having to rethink about your life. What would you say were the hardest times in that process?
Well, you're forced to first cut back on things that were your normal. You're forced to really readjust your life in terms of your budget and your spend. You think about your hair and you're like, is it ever that serious? I can go natural. And so you go the natural way. You figure out how to do your hair at home, figure out how to do your nails at home, have to cut back on luxuries because, going out for a movie and coffee, it becomes that. Yeah. Cutting back on the kinds of foods you even eat at home because, I'm a nyama girl. I love my meat. But now I've had to learn how to increase my palate, the things that I eat, beginning to love the legumes and the cereals and finding new and better ways to cook those so that they're, exciting to me. And just also cutting back on social interaction. Sometimes it's just not possible to be there for everyone and to attend every single event. And so, it's eating into your budget, so you cut back on that. But I think it's also been hard to not have imagined back then that at today I wouldn't have yet found steady employment, and I've had to juggle between business and a few things here and there to make ends meet. I think that was hard. I've never not had a job. So from May 2015 to today, having a few instances of consulting here and there and having to rely on business, I think that's been a hard journey, but I think I'm better for it, I would say.
Okay, and you touched on the social interactions also lessening. Most people have said this is the time where they have known their real friends. Talk about that.
Well, when you're no longer at the coffee dates or can't make it to the lunch and the dinners, and you have to keep, trying to explain, oh no, this time I can't make it. At some point you start having to explain that. But then you know who your friends are when they check up on you and ask you, are you okay? I know you'd love to have this event or go to this event. Come, it's on my tab, So you know who to keep and you know who not to keep. And I think at some point you don't even have to make too much effort because it just naturally, they slide off. They slide off because maybe they can't take your no for an answer. And so you learn how to manage with the circle you've got. And surprisingly, I think I ended up with a circle of friends who were kind of facing a similar situation as mine. And so we were able to then gel in better and, admonish each other, encourage each other. And I guess I also came to accept that some friendships will be for a season and they'll die off when they die off, and others will keep growing when they grow. So you just adjust.
Okay, now I hear a good adjustment to loss because there's a lot of loss in this season. How is this crucial in surviving and riding the tide?
Yeah, I think it's coming out clearly. Loss is a huge thing, and sudden loss is even an added, pain, because everything comes down suddenly. Now, the kind of losses that people have gone through, Gladys, are basically, just like death. There's such finality in the job losses. There's such finality even in friendship losses. And there's such finality in some people even losing, where they were living because they've got to move maybe to cheaper places. And we know from a psychological point of view that adjustment is not an easy thing. Even if somebody is adjusting upwards, they were in a lower social cadre, they have moved to suddenly they've got this, a huge salary. And you see the way it's playing out with with MCS. I'm not ashamed to say that, because maybe some of them came from hustling, and then they were elected, and suddenly they have got quite a bit. So whether it's upwards or whether it's downwards, adjustment is a very complex issue. And now when we've got to adjust in every way, you're adjusting socially, you're adjusting spiritually, you're adjusting in job, financially, everything else. Now, a lot of people get overwhelmed. I'm really appreciating that we are still seeing people who have adjusted and they've gone to what they need to do. Now, one of the things that has been mentioned really carefully is that there's no need to make too much effort to hang onto someone that you can actually see is sleeping. Because the moment they start changing their call frequencies, or when you call they are not answering, please, we need to remember that that person could also be in a space where they don't know how to handle you anymore. Now, I've had situations where I'm supporting people whom they are the only ones at work, and most of their friends have lost their job. So they're the only ones at work. And so they don't even know now how to reach out to 10 of their friends. So they are silent, and it's not like they don't care, but it's just they're also overwhelmed. Some of them, they are working, but only one of them is out of job. But we don't know. We have not been trained very well on how to go to people when they have gone through loss. So when we say the word pole, sorry, sometimes that is not even, it doesn't suffice. So people don't know how to handle their friends.
And how should you do that?
I think one of the best things, and that is happening now to what is being mentioned even with my colleagues on the panel, is it's just important to have the courage to find out, how are you doing? And once somebody is telling you how they are doing, it's so easier to ask someone, you know, I just don't know how to support you, but how can I be of help? What can I do so that I can just support you and be realistic that I can be able to do the little that I can?
Yes.
You remember Dr. Bosire talking about the son being picked from her?
Yes.
You know, and just being put away for her for some time. You know, those little things that we do. You know, right now, it's not a huge thing that you do. It's the little things that you can be able to do for somebody, and according to you, you know, how much you can be able to do. So it's a whole range of things. If Gladys just needs me to just leave her for 4 hours, please don't call me today, but then I'm making sure that, are you okay? Or what would you be doing within the time that you don't want me to call? So as long as you're okay, then I can be able to then say, okay, I'll call you tomorrow. And then we just keep, you know, our promises of even a call, keep a promise of, you know, maybe doing something, supporting someone. Yeah.
Reaching out to each other.
Yeah.
Very crucial. And speaking of which, a renowned sociologist, Dr. Ken Ouko, died on Saturday at the Aga Khan Hospital following complications from COVID-19. Now, Dr. Ouko, who made his last appearance on Your World a number of weeks ago, has surely left an impact in the world of sociology. Anita Nkonge with our report.
Dr. Ken Ouko endeared himself not only to his students of sociology as a lecturer,
my Kiswahili.
but audiences as well across the country, as he graciously helped explain societal issues during interviews. Little wonder the outpouring of condolences from students, colleagues and friends that were shared on various social media platforms, as many shared their fond memories of the late Ken Ouko. Ouko was a senior lecturer at the Department of Sociology at the University of Nairobi, specializing in areas of deviance, family, gerontology, and medical sociology, and even made numerous TV appearances.
We find difficulty in social behavior because if it's criminal or legal behavior, so to speak.
The University of Nairobi confirmed that Ouko had passed away at the Aga Khan on Saturday, where he had been receiving treatment. He had been admitted earlier after testing positive for the coronavirus. Professor Magoha, speaking during a visit at Maseno University, highlighted Dr. Ouko's death as a reality check that COVID-19 should not be joked around with.
He's much younger, he's not even in my age group. And therefore, this issue of getting ready is a matter of life and death.
This is the fourth death caused by COVID-19 that the University of Nairobi has suffered. The other recent loss to the fraternity being that of senior lecturer Julius Wamangoli. The NTV family passes our sincere condolences to the family and friends of Dr. Ouko. The sociologist of great flair will definitely be missed on air. Anita Nkonge, NTV.
And we reiterate Anita Konge's words there, even as we remember Dr. Ouko. He was a great, jolly man and a definitely good scholar and good at what he did. May his soul rest in peace. So this is reality. It's happening to all of us. We've lost loved ones, we've lost jobs, we've had to adjust massively in our lifestyles. Our family lost some friends, and of course, adjusting to the new reality. And that's why this morning we are asking you, how are you doing? How are you really doing? It could do with work, family, friends, you know, relationships, and would like you to reach out to us, that hashtag new normal. And remember, you can also text in or call us using that number on the bottom of your screen. If you have some of those views coming through, let's look at some of them. We have Paul Ochanyo who says, I'm not surviving, I'm actually living by faith in the Lord Jesus Christ. Amen to that, Paul. A good, positive attitude is bound to take you very far. Martin Muduri says, just trying to figure out agribusiness, if it can help out during this trying moment. Yes, it can. One thing we have seen for sure, pandemic or not, is that people will always eat. Charles Moura says, we are surviving through God's grace. The government prefers body bags over face masks. It is a sad situation and we hear you. Klaus says, nothing, just waiting for God to supply. Klaus, you represent many people who feel like they are on their knees at this time. Polisana Yatich says, it is tough, silence and time heals. It is interesting. Silence at times actually is what some people need, not you being in the spaces. James Ndugo says, it's by God's grace that we are surviving, and that is for sure. There is a lot to deal with and a lot of changes to look at every day. And a last one here for now. Debbie Deb says, only God knows. This is hell on earth. Polisana Debbie, and we pray for better times ahead. Remember, keep talking to us, that hashtag new normal, even as we encourage each other during this season. We'll be right back.
Ndovu flowers are fortified with vitamins and minerals to provide wholesome goodness for the whole family. Ndovu all-purpose flour makes the most delicious chapatis, mandazis and all other pastries. Ndovu is readily available at your nearest shop. Ndovu Tosha.
Prophet Muhammad sallallahu alayhi wasallam taught us about plague. He told us that if it's happening in a place, don't go. And if you are in a place that is happening, don't come out. Prophet was preparing us for quarantine, and he was also telling us to take precaution, that we should not be agents or carriers of the virus. It should not be us who are going to carry the virus, take it to our congregations. For this reason, our congregations, we've decided that since faith is in the heart and everybody knows where his faith is, we have taken this time to stay at home, pray at home, do our prayers, because when you're at home, you are still with your Lord. God will not forsake you for being at home because you are not in the mosque, but know that even at home, you can still pray to God that he helps us in this big independent pandemic that is in the world.
Mwenyezi Mungu atakufungulia hazina zake nzuri kutoka mbinguni na kubariki kazi za mikono yako. Utayakopesha mataifa mengi, lakini wewe hautakopa. Mungu atakufanya kuwa wa kwanza na sio wa mwisho. Hakika utaendelea mbele na sio kurudi nyuma.
To get blessings za maisha, SEO Skiza Tune, dial star 811 star 928 hash.
When we moved from analog to digital, we took the opportunity to share our talanta. And the rise of local radio represented our voices mtaani. New ICT and educational platforms are going to make sure that no one is left behind.
Communications Authority of Kenya, opening your world.
Thank you for staying with Your World. My name is Gladys Gachanja, and today we are finding out how we really are doing in our day-to-day life, even as we adapt to this new normal. And definitely from what the panelists have talked about, the different aspects to the same. And we'd like to hear your aspect, and that is through your text message, #NewNormal on our social media handles. And you can also text in or call in. And speaking of which, would like to know how those in Wajir, Baringo, and Eldoret are doing. Listen in.
Wajia tuko hapa shida sana, ajali ya corona imetueffect baya sana. Kila kitu imekuwa yani hakuna kila kitu imesimama. Watu wanashikwa ovyo ovyo, yani ugonjwa kila mahali. Tunaomba yani serikali tusaidie sana sana, kama Wajia hatuna mavifaa, hospitali hakuna makitanda.
Kutembea usiku saa 3 hata akitaka mahali hospitali mgonjwa hakuna mahali anapeleka. Mtu agonjeka utamngojea mpaka asubuhi.
Mabiashara imezorota, uchumi umezidi kuendelea chini. Hadi wa sasa tunagoja tu Maulana atubadilishie.
Since this corona thing came, it has really affected us. And especially when it comes to movements from one point to another, you will notice that even when it comes to interaction with families, we are no longer meeting with our families, our parents, and all that.
We are not able to move, especially for me as a person. When we are told that if you are above 60, you don't travel, I took it positively and I decided to remain and to rest and to communicate with the children through phones and any other way we can get together.
Tulikuwa tunategemea wageni from other countries kununua vitu like rungus, like bells, lakini kwa sasa tumekosa hawa watu. So hakuna mahali pa kuuzia, hakuna mahali pa kuenda. Saizi ni kukaa indoors, stay at home. So imekuwa vigumu sana.
Mimi mwenyewe kama MC tumeathirika sana, ni wakati huu ambayo corona ilifika. Every weekend, every Saturday tulikuanga na kazi. Lakini tangu corona ifike mambo imebadilika. Wengine wetu pia wameshindwa hata kulipa rent kwa sababu wengine wetu hiyo ndio ilikuwa tu ni mahali wanaweza pata pesa.
The clients wenye walikuwa nakuja, that consistency ili break, ilikosekana. Clients wakikuja unapata uko na piece of art which is worth around 5,000, but since there's no cash and a client wants it, then they don't have cash. Yet I personally also on my side nahitaji hizo cash. So I have no alternative but to sell that piece of art at that lower price so that I can also get something to eat.
Adjusting to the new normal, and those are views from Kenyans from many regions across the country. Excuse me. And a burial ceremony at the Abagan Cemetery in Molo, Nakuru came to an abrupt end due to violation of COVID-19 guidelines. The burial was attended by more than the required number of mourners. Nuru Abdulaziz reports. All right, we shall get that report later on in this broadcast. And we continue to find out how you are doing. Let me bring in Dr. Bosire. We were talking about the importance of not stigmatizing a condition that we cannot say that affects one person and leaves the other. We are all susceptible to it. For you as a healthcare worker, how does stigma look like for you?
I think, I mean, you guys have been broadcasting stories of patients going into hospitals and they have a high fever and they're coughing and healthcare workers running. All right, that's stigma which is propagated by healthcare workers. But then there's also community stigma which is propagated by people who live around us. That, for instance, I have heard of individuals who have either been discharged from hospitals and the neighbors don't want them there. They are, they are being very hostile to them, right? Even after being given a clean bill of health, and which from our end is when we've done 2 negative COVID tests, 2 tests for COVID, and concurrently they have been negative. So we've seen all that coming in, and we've also seen that even if there is an individual is sneezing, like literally right now, it's a very difficult time to even have a cold.
Yes.
You sneeze a bit, you cough a bit, and everyone is like, oh wow. That's corona. You see, those are internalized stigma that we have to deal with. And we have to really learn from HIV, right? The fight against HIV. that the win towards eradicating or reducing the spread of HIV was only won when we dealt with social stigma, when we ensured that women were protected, ensured that girls are protected, they were not disinherited. And just carrying those lessons right now around COVID are going to be very important. And that's one of the things that we also have to cross-learn from other infectious diseases like HIV and tuberculosis. That as long as we continue castigating, we continue looking at people who have either been infected with COVID or are at risk of COVID as people who are a threat to us, then we are going to really fail. As a healthcare worker, I mean, this is a very difficult time for me to say I'm a doctor. Unfortunately, I am a very public face, so everyone knows that's Dr. Busire. And trust you me, I've had people run away from me. Oh, Daktari, oh, we were supposed to meet, like, I think we will meet another time, you know? And you just know that because I still have contact with patients, that's why they're scared of meeting me. And I mean, and unfortunately, if you get sick, you'll still land in my hands. So you also have to really protect us as your healthcare workers and not not stigmatize us. So those are the critical things that we have to, that if we are to win this, the fight against COVID, like we did win and we continue to win fight against HIV, we must be able to address social stigma in all its aspects.
Okay, very well said. Let me bring in David Kingatwa. When we talk about stigma, it's not only because of the virus, but just life in general. Your life has had to readjust. You don't have as much as you did before, and you're not able to do some of the things that you could deliver for some people. How are people reacting to you now? Do you feel shunned to an extent?
In my case, I wouldn't say that, because I have really invested in very solid relationships, and especially as a family and as an individual. And we have worked with people through good and tough times. And so this was just another hard time that we have been able to work together. So for me, it has not been that bad, because of that, having invested in a very huge support system. So I wouldn't say for me it has been really a huge issue, but yeah.
And you know, as you mentioned earlier, men have a hard time talking about their challenges. So I guess the greatest stigma will be one against yourself, in as far as how you title yourself in this new changes and new life we are facing. What is your message for men?
Well, one is trust in God, because if we do not have that hope in God, then most men will go down. Number two, have a place where you can open up. You can open up and speak and share what you're going through. That way, when you have an outlet, you're able to just cope with what is going on, and also invest in relationships, reliable and relationships that after some time you can withdraw, because you can never go to an ATM to withdraw something that you haven't deposited. You must deposit in someone, and then one day you will withdraw.
Very well said. Sophia, I'd like to hear from you. You have a very positive outlook to the changes you have faced and even the season we're in. But are there times where you felt alone?
Definitely, definitely. I mean, there was a dark season, and I think I went through it for the most part by myself before I figured that this wasn't healthy, and then I had to seek different avenues. But yeah, I've definitely felt alone. And then, you know, you look on social media and find everyone else's life has moved on except yours. And so, you know, in that season, what I had to do was just check out all the noise. Social media for me at that point was noise. I had to just get off some platforms so that I stop feeling negative about my life and feeling like I'm sinking deeper when I see people escalating higher, you know. Yeah, so there have definitely been dark moments.
and you have been able to, you know, keep yourself, keep your head above water. What would be your words of advice for those who are feeling they are at their worst at this time?
For starters, I'd say don't be in denial about what you feel. Don't be in denial about where you're at. If you must seek help, please seek help, because it can be a dark tunnel to go through alone. Secondly, for me, I'm a spiritual person, so I sought my spiritual side, so I got closer to God, and quite frankly, it's by His grace that I'm still alive and still hopeful and still thinking the best of myself, speaking positivity to myself from the Word of God. I'd also say to someone who's out there who thinks that it's the end of the road, that it's not. That your best days are ahead of you. Find out how you can recalibrate, reset yourself. I'm sure there may be ideas that you had thought of that you never quite you've never quite done, things you wanted to do, you haven't done. Get into doing them, learn new things. And I'd also say your identity is not your title at work or your title as a woman, you know, Mrs. XYZ or Mama Nani, because I also had to deal with that at an interview where I was told you're childless, jobless, spouseless. And, you know, at some point I thought, those are labels that you're putting on me that I refuse to accept. So you just have to dig into yourself and find all the positivity you can find, so for you to keep going. Cut out your negativity. If there's anything negative in your life, you just need to get rid of that. But honestly, God, that has been my anchor, for real.
Very well said. Now, for you, Sydney, a young man trying to find his way even in this very tricky times, and you have said how tachagua kazi. What would be your words of advice for the young ones especially?
What I'd say, so long as you're putting something on your table, you don't have to feel ashamed about it, because if you don't do this thing that is bringing something to your table, you're going to beg. And if you're going to listen to that person who's saying you are doing something very shady or something, or whatever it is you're doing, as long as it is legit, do it. It will bring something to your table, instead of you not doing it because someone has said it, then you go begging. Then they'll say again, we are not omba. You see, so just go for whatever you're doing, and things will open up.
Okay, and as you're talking about opening up, keeping an open mind is also a good thing. When you went into the Babamboga deliveries, is this something that you think you will stay in now that you've seen it's a very lucrative space, or for you this is just a stepping stone to a better future?
It started off as something I'm just doing to cushion myself. But then again, the reaction, the feedback, and the number of people that you're engaging, I think this is something that is going places, and this is something that is going to change lives, and this is something that is going to employ people. So I'm really into this. I didn't know it will come to this, but I'm really into this, and I'm looking forward to greater connections and greater partnerships.
Okay, and it all started by trying and keeping an open mind. Lois, even as we readjust, each to their own circumstances, what are the key components that we should keep in mind?
Yeah, I think something that has been brought very clearly has to do with, you know, the greatest stigma is the self-stigma. Yes. I came face to face with this. I live in Utawala, and you know the story behind the Utawala and the issue of the priest. Now, it was extremely, you know, it had to take some of us who are confident and have facts about Corona for us to be able to even walk out of our houses and still say, I live in Utawala. And we were experiencing that kind, and a lot of calls which were coming in really as a joke. Someone is saying, oh, I understand where you are, and then I actually tell them, by the way, the case that is being talked about is where I live. And it's like, oh, and you're not panicking, you know? So there is a way in which people, if you don't self-stigmatize, then you actually assist other people not to stigmatize. Now, remember, there's a way Kenyans, we sometimes watch a bad situation being planted and getting worse. Because there is this thing of Nairobi. Everyone coming from Nairobi has Corona. Mombasa has Corona. you know, and we left it to sort of like just go on. But I'm glad now counties have been opened up. So great, if I'm going to my home, the rural home, and you don't want to come to me from Nairobi because I'm carrying corona, in fact, that gives me less pressure so that I don't have to support many people. So sometimes you've got to speak certain things and look at things positively rather than trying to say, why are you running away from me? Because look at it, you know, I remember a friend of mine said, if you don't want to take tea, I've saved a lot of stuff. I've saved milk, I've saved my energy. Yes. So it's not like I'll keep on, baby, you want water, I'll give you water. But you see, we are used to this thing of wanting people to appreciate us. At such a time, a lot of people will not appreciate a lot of things that you're doing because you have to adjust. And the adjustment must be done, you know, and these are things that we've just got to live with them. Then the other key thing that we need to do is, you know, with stigma, the more you listen and the more you try to justify and you want to explain yourself to people why they should not stigmatize or what happens, is the more you get so worked up and the more the stigma blows up. So I think it's just a time that we stay with the facts and leave a lot of feelings out of the situations that we are in. That I feel this because maybe I've lost. By the way, personally, I lost my paying job, my 8 to 5 paying job. And I had to just quickly slip back into the work that I also do and I do best, you know. So these are things that are real. And I remember someone telling me, you don't need to tell people that you've lost your job because it was a good place. It was a social place. I was actually in a place where I was doing a lot of administration. But then I was asking myself, what's in a job loss? Yeah, if the contract was not renewed, do I need to be ashamed of it? Do I need to justify that a contract was not renewed? So these are some of the things we must really talk positively, like Sophia is saying, about our situations. And I like the way she said, for starters, you know, like I was just saying, starters, yeah, there are people who are just beginning to lose. But then the most important thing is that there are some people who did not invest in friends like David did, in their social network, because they are not very social, they are not outgoing. Now, those are the people, Gladys, that I would really encourage them to reach out to somebody, whether a professional, you know, reach out, because you go to a professional. If you have some little resources, you'll pay. If you cannot find a professional person because you don't have the funds, there are spiritual places. You can go to those places. I think there are certain terms that are really creating a really big challenge to us, because we are not under a lockdown yet. We are under restrictions to specific things and social distancing. In fact, that thing should have been called physical distancing, because it's not a social distance, it's a physical one. So we need people to realize that if I feel like I'm so alone, then I need to reach out to somewhere that is solid, somewhere which is professional, somewhere which is spiritual, to somebody who can be able to speak to me and I can speak to them in confidence and be able to just let them know that the kind of pain I'm going through. Yeah. So it's really important at such a time for people to reach out to a certain support system. Remember, all these people are talking about support system. There is no one at this time that can really, you know, live and adjust and go through some of these losses without having a support system.
Okay, and speaking of loss, we go back to that story I mentioned earlier. Burial ceremony at the Elbagon Cemetery in Molo, Nakuru came to an abrupt end due to violation of COVID-19 guidelines. The burial was attended by more than the required number of mourners. Nuru Abdulaziz with that report.
They came out in large numbers to bid farewell to their own at the Elbagon Cemetery in Molo, Nakuru County. The ceremony went on uninterrupted until the area chief, Francis Ngacha, arrived.
Mazishi inatakikana watu 15 tu wa familia. Sasa hata mkihesabiwa hapa mko watu wangapi, lakini watu wamezidi hata karibu 400. Itabidi disperse muende tu nyumbani kwa sababu hata gari ya usi inakuja. Iko kwa njia.
Over their dead bodies.
Yaani wananibu. Ni kama hakuna kitu ninaongea. Wacha nipige simu tena. Mnapiga kelele, basi haya mazishi hayataendelea. Kama mnafikiria ni mchezo iko.
No one was budging.
Hatuwezi fanya kazi vile
watafanya vile wanasema.
Nawaambia
they had violated the COVID-19 guidelines in terms of the number of those who should attend the burial and social distancing.
Na mimi natoa onyo kama chifu wa Elbagon kuwa hatutakubali watu kutotii sheria.
Kwa shida hii ya COVID, chifu ametukuta akasema tujafikisha mikakati yenye imewekwa kwa sheria na akatuamurisha tuzike kwa haraka bila kutupea hata madakika ya kusoma biology.
Serikali basi ichukuage hizi jukumu. Wanakuja wanapanga vile tunafaa kukaa.
Although they had a hard time letting the matter rest, they finally laid their loved one to rest. Nuru Abdulaziz, NTV.
Which brings us to the conversation earlier brought about by President Uhuru Kenyatta, even as he was lifting the cessation of movement in some counties. And he was very clear that COVID is here with us. We need to readjust, to live with it. But then again, a great personal responsibility needs to be used to go about your business, because the government cannot help you out in this one. It takes you to protect yourself and by extension, protect others. Listen.
Jukumu iko mikononi yetu. Kila mmoja wetu. Kila mwananchi. Wengi walikuwa wanatarajia ya kwamba tutasema tutafunga nchi tena. Kufunga nchi haitasaidia kwa sababu vile nimesema, serikali haiwezi kuwa kwa mlango wa kila mwananchi. Jukumu ni letu, kila mmoja wetu, kuhakikisha amelinda maisha yake na maisha ya wale ambao ni wapendwa wake.
Let's all take personal responsibility, even as we check up on each other and ride the tide. And speaking of which, remember, we are getting to find out how you are doing. At this point, let's listen in on how the people of Makueni and Mombasa County are doing.
Kazi zenye tulikuwa tunafanya, kama mimi nilikuwa nafanya kwa hoteli, tulikuja tukaanziwa na retrenchment. Hiyo sasa hapo tumekosa ajira, wengi hatujarudishwa kazini mpaka wa leo.
I was able to work, travel to different counties, do my work, earn money, but now I'm only localized to one place. The other thing is on the side of stigma. Having traveled, you come and lose clients because they say you should go for isolation.
We have experienced both positive impact and negative impact. The only positive impact which I can say is that it gave us an opportunity to have what we call family bonding, because we have time with our children, which was very rare. The negative effects are many, one of them being economy, of course, loss of jobs. And I can say that the side hustles we used to have, they are no longer there.
Wananchi kwa jumla hakuna nyuma wala mbele, kwa sababu yale mabiashara zote zilikuwa zikifanyika, tuseme katika Mombasa, Nairobi na kwingineko, tunaona kama imepungua mno sana.
Mpaka sasa hii mshahara imepunguzwa, na yake wanasema pesa hakuna. Kwa hivyo sijui kama ikiendelea sana tutapata pesa wapi, maana yake maisha imekuwa ngumu sana.
Kuna customer wangu wengi ambao walikuwa ni hawa wa shule wa university, lakini kwa saa hii biashara iko chini kwa sababu walikuwa wanani promote sana upande wa manguo, lakini kwa saa hii hawako.
Those are the views of those in Mombasa and Makueni County, respectively. We're still hearing from you how you are doing coping with the changes on a personal level, family, work, business, and that list goes on and on. Antonius Kimayo says, my condolences. Can the umbrella body on workers focus on how expectant health workers can be given a reprieve? I think this is in reference to what Dr. Bosire said. Mwangi Ndongo says all expectant health workers should be given a compulsory leave because they are at risk of contracting COVID-19 due to low body immunity. Miriam Kenneth says, cha kushangaza, Kenyans are not believing that COVID-19 is here. They don't see or hear. May Dr. rest in peace. And that is in reference to the passing of Dr. Ouko. It is sad indeed. And again, personal responsibility and awareness will protect me and you. Thank you so much for all that were able to join us on this conversation. Dr. Stella Bosire, who is a medical doctor, David Kingatwa, who is a director and Experience Agency Limited at Experience Agency Limited, Sophia Wamboi, who is an events planner, and of course, Enicha Zima, who is a creative and now is a Baba Mboga deliveries guy. Well, we take a short break. When we come back, we'll take a look at how the country and the region at large is doing. Stay with us.
Various institutions have reported over 800 million units of unclaimed shares among other assets. To find out if you are an owner or beneficiary, dial *361# or visit www.ufaa.go.ke.
Breaking news from Molfix. Let's see what they're developing right now.
That is just for me. It really feels very comfy.
Molfix pants with anatomic fit technology. New Molfix pants, an invention from babies for babies.
You should also try Molfix.
Pata smartphone mpya kuanzia 20 bob daily pekee ukilipa mdogo mdogo. Weka down payment ya 1000. Lipa kuanzia 20 bob daily kwa miezi 9. Piga *544# kuona kama unafaulu kupata 4G Neon Ray Pro. Si hapo Safaricom ni yako kabisa.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate. The 1, 2, 3 with Colgate and give yourself a future to smile about.
When we moved from analog to digital, we took the opportunity to share our talanta. And the rise of local radio represented our voices mtaani. New ICT and educational platforms are going to make sure that no one is left behind.
Communications Authority of Kenya, opening your world.
It is your world. My name is Gladys Gachanja. Now let's take a look at the other world. Now, Africa probably has higher figures of coronavirus infections than the official number because of lack of testing. And this is according to the World Health Organization. According to WHO's regional director, the organization does not consider that there is a hugely underestimated situation.
We need to get the testing up in African countries. We need to increase the testing, and we'll be convinced that we are seeing the correct situation when we see high rates of testing with the positivity at around 5%. This is the case now in relatively few countries. So there's still a lot of work to do to scale up the testing and appreciate the true situation. So conclusion, yes, there is some underestimation. We have seen that in a number of countries that have increased testing. But as we keep saying, we do not think there is a hugely underestimated situation. And we particularly don't think there are, thousands of people dying on the continent undetected.
Elsewhere, the streets of central Harare are empty as soldiers and police patrol to enforce a ban on protests. Demonstrators had been set to take to the streets to protest against alleged state corruption and the deteriorating economy. Police crisscrossed the central business district on Thursday using loud hailers to order people to stop whatever they were doing and go home. At checkpoints, busloads of people heading into the city center were turned back. By midday, streets were deserted and shops including large supermarkets, were shuttered ahead of protests that Home Affairs Minister Kazembe described as an insurrection. Opposition politician Jacob Ngarivume of Transform Zimbabwe, a small political party, called the protests for Friday, which would mark 2 years since the disputed election of President Emerson Mnangagwa. In Addis Ababa, the capital of Ethiopia, authorities are concerned about public complacency on COVID-19 as once empty restaurants are filling up and Ethiopians stop respecting health measures to stop the spread of coronavirus. Addis Ababa has around 3/4 of the country's COVID-19 cases, and Wandimo Taye, communications officer with the City Health Bureau, says we teach people to apply these measures, but some people put their masks in the pocket and wear them only when our teams are around. Kedir Bediru, a vendor, added, although the coronavirus is bad, the scarcity will even be worse. In my opinion, it's better to follow the precautions and make a living. Mola Teshome Ambaye, a health worker, says the lifestyle of the people in this area depends on mobility. People travel back and forth to this part of the city for different social and economic affairs, and that helps the virus to spread easily.
Okay.
Now, Benin commemorates the 60th anniversary of its accession to independence without the traditional celebrations due to the distancing measures imposed in the fight against COVID-19. The government had announced that there would be no festivities and cancelled the traditional parade of security and defense forces, considered to be the biggest attraction of this commemoration in 60 years. Even as we look at the other world at this point, let's bring in Malata Matthews, who is a reporter based in Malawi. Matthews, good to see you. Now, Malawi actually ranks 22nd in the continent as far as the prevalence of COVID-19 is concerned, with around 4,000 infections and 120 deaths. What are the challenges trying to keep the number of infections on a low?
Sure. Good morning. I think there are three key issues. The first thing is that very few people are adhering to the COVID-19 precautionary measures as being advanced by the Ministry of Health officials. We are doing business as usual. there's no lockdown in Malawi. We still have got people playing social football. The markets are usually crowded, people conducting funeral ceremonies with thousands of people, hundreds of people. So I think that is really one of the biggest challenges. Secondly, there's still denial. You know, people have got symptoms, they feel like something is wrong with them, but they're not trying to go to the hospital as quickly as possible. So the health-seeking behavior is also quite very low, especially among men. That's what some of the experts have highlighted. But also the other issue is that we're seeing that the health workers are having lots of challenges in addressing these issues. The numbers are still low, the number of health workers. We have got equipment challenges, the quarantine or isolation centers, they have got also limitations. So all these things are really bringing in challenges to make sure that we're able to keep the figures slow, but also win this fight of COVID-19.
Okay, and Malawi stands out as the only country in the world to actually announce a lockdown and then cancel it before the restrictions actually came into force, following a reversal of the same by the High Court. Why did this happen in the first place? How did we get here?
You're right. So from the legal perspective, we have had challenges in terms of the legislation. We are using the 1948 Public Health Act. That's like 72 years ago when this Health Public Act came into force. And we also have the 1992 Disaster Response and Preparedness Act. So I think the government had challenges to build up a strong case to enforce the lockdown measures. And secondly, it's also an issue of politics into play. I think the lockdown came at a time when the political stakes were very high. The country was heading towards an election. So anything that were seen as too hard on the people, you know, was seen as something that was aimed at victimizing the people. And then the opposition political parties took advantage of the same to say, I think the government is trying to be harsh on the people. There were no lockdown, you know, caution packages for the poor, for the vulnerable. So all these things, it kind of affected the lockdown plan which the government had.
And you're talking about a reversal of the lockdown in April and an election in June. Do health experts actually think there is some correlation to the high numbers of infections?
That's right. So we have done about 31,000 testing this far, and 4,100 of these have yielded positive. Half of them have recovered, of course, and we still have about 2,000 or so active cases and 125 deaths. Most of these deaths have been registered in the month of July. That's immediately after June when we had the election. So there is really a direct correlation, and they think that the campaigns that we had really has contributed to the situation that we're having at the moment. But it's also good to note that testing has increased a bit. So that also maybe could be one of the factors we can talk about. But on Friday, we're engaging some of the health experts. They have indicated that I think the worst is yet to come. We should expect tough moments in the month of August.
Okay, and the country is said to face malnutrition and infections or infectious diseases due to the devastating effects of Cyclone Idai sometime last year. Are there measures put in place to cushion the vulnerable?
Yeah, it's a challenge. The director of disaster risk reduction in the Department of Disaster Management Affairs, James Yusiwa here in Malawi, indicated on Friday that most of the Build Back Better programs are really facing challenges. It's hard to build back better at the moment, and those people that were affected by different disasters, including the floods, are not yet back into their usual life. They are facing lots of challenges, and reaching out to them is becoming a problem since the focus is really on helping or managing these COVID-19 cases. So he admitted the government is facing challenges, but there are some efforts which are being put in place, but they are really slow. And chances are that as we are now shooting towards the rainy season, I think it's just a month away, we should be expecting maybe another disaster. We should be expecting floods, and that is going to complicate the whole situation. We'll have more people looking for food, we'll have more people looking for help, but the government is not yet prepared for that at the moment. And no serious plan has been announced by the new administration, and people are looking forward to see what the new government is going to do for the vulnerable people or for the poor that are in the country.
So apart from COVID-19, definitely politics has been at play in Malawi following June's presidential elections and subsequent win of President Lazarus Chakwera. So how far has his presidency impacted on the politics of the day in Malawi?
So a lot is happening at the moment. The focus is on trying to make these administrative adjustments. There are new announcements that are coming up each and every day. The Tonse administration, led by Chakwera, raised the bar way high, so much that now Malawians are really desperate to see the changes which these politicians were talking about. So every day is a new day, new things being announced, new changes happening. So I think the focus is very much into adjusting, making a number of reforms, changing heads of government institutions. We have seen the police having a new head, the Malawi Revenue Authority, and all these big institutions that matter. But also, the Tonse administration has been promising to deal with corruption. So we have seen a number of arrests that have come through. And last Friday, the fiscal police interrogated the former president, Professor Peter Mutharika, on suspected corrupt practices involving a cement deal. And also some of the guys that were closer to him have been arrested, have been locked up. Some have been granted bail, and we expect more arrests as we go by.
Okay, and of course, a former evangelical preacher, President Chakwera, promised to tackle corruption on his election ticket, but later unveiled a cabinet that has been criticized to be tainted by family ties. How are Malawians taking that in?
Sure. So the cabinet was received with mixed reactions. People really felt it was full of families, cronies, and then people protested on the social media. But the president assured Malawians that they should give him a benefit of doubt. He believes the people that he has appointed into the cabinet are going to deliver. He claimed that he didn't care who the people are, what he looked were just leadership qualities and their capacity to deliver. So people are just looking forward to see if the cabinet is going to deliver. And they have given them about 5 months. The president has given the ministers 5 months before they engage themselves into some sort of a public assessment. They're going to do a public interview to see how much they are fared. Those that are going to perform, they shall be fired. That's what the president has said. But anything can be said by politicians, and we yet to see if whatever has been said is going to really come into effect.
Okay, and of course, President Chakwera's win marks the first time in Africa history that an election rerun led to the defeat of an incumbent. Does that mean Malawians have a lot of, confidence in the presidency of Chakwera?
Well, people are taking it cautiously. Politicians sometimes can say so much and do little. Yes, people are happy there is change because there's a lot that wasn't happening the right way in the previous administration. But also, we have to be mindful that about 1.7 million people voted for the former president. So there are some people who have got high expectations on how some development activities are going to be done, especially that we are waiting for the new budget. There is no new budget yet, and the new administration is yet to put up a budget and announce some of the measures that are going to take now onwards, and as far as taking the country to another level is concerned. So people are just waiting to see what sort of budget is going to come up this time around and what sort of policy direction is the new administration going to take. Until that happens, I think now it's kind of a wait and see situation whereby the government is simply focusing on structural reforms and public reforms to make sure they're able to carry out whatever they need to do in a most effective manner.
To take you back a little bit on the COVID-19 management in Malawi, are schools and religious institutions opened?
So no, the answer is no. We have not opened schools. That restriction is still there. though not backed by the law, but I think there seems to be that general consensus, despite the fact that some of the precautionary measures are not being followed. We also noticed that there are some churches, religious gatherings, that are able to follow some of these precautionary measures, but largely we still have got a problem. The government tried to enforce some of the measures, like around the markets and other places, but they were also restricted by the same injunction which the human rights organizations obtained. And what the government is trying to do now through the Attorney General is to remove this injunction and make sure that it is able to implement some of the restrictions or what I would call lockdown measures so that they can try to control the spread of the virus.
Now, Malata, before I let you go, you heard the conversation we've been having this morning just to find out how people are doing. As a reporter at the front line, telling the stories of Malawi at a time where we are facing a pandemic, how are you doing?
Well, these are tough moments. It's not easy to go out unnecessarily. It's a matter of life and death. So you really have to decide what you want to do, where, how long. The challenge is that as a person, I'll do all I can to make sure that I can wash my hands, I can wear my mask, I can watch my distance. But you find that the people you're meeting out there, they don't care about it. The transportation system is really doing things as usual. If you go into the market, it's business as usual. You go into the shopping sprees or these chain stores, it's business as usual. Some are really trying to put all these buckets for people to sanitize and all that, but many seem to take this thing lightly, and that's why it's hitting hard. And I think it's really a challenge until we rethink about this, until we change our mindset and accept that this virus is here. Maybe we are going to see a bit of change in terms of the way we are behaving. But otherwise, it's really, really a tough environment. Businesses are closing, people are losing jobs. You don't know what's coming up the next day. So it's still an environment of uncertainties, and you're not too sure what's going to happen next.
And speaking of uncertainty on a personal level, how are you coping with that?
Well, that's kind of tricky, but we're coping. The key thing is to make sure that you're able to do the little things you can do effectively so that you can get the maximum results out of it. So it's a challenging kind of moment, but we're trying. It's not easy, but we hope that we'll walk over and we'll get over this.
Thank you, Malata Matthews, our reporter in Malawi. Thank you for that brief outlook of how Malawi is faring on during these times and, of course, post-election now that they just held their elections in June. And back in studio, Lois, definitely some of those that are also walking the front line, in the front line are journalists. And every day we come to work to ensure that we inform you, but we are living with the same reality as you. What would be your advice to the fourth estate?
I first and foremost really appreciate, and I've had to speak on phone to quite a number of people of the fourth estate. And again, it comes to the whole concept of knowing that this is an issue that we have and staying with the facts. I think I will shout staying with the facts because there is a way in which you can contract this disease. It just doesn't blow in the air. So the personal safety, just ensuring that someone also you're safe and the other person is safe. And I think it's a simple but a very complex process of keeping safe. And I think I'd like to again just say that it's a time that we build our faith and hope that things will get better, and for sure they will. And that faith and hope is so anchored in our spirituality and what we call a higher power. It's a time, we are not talking religion, we are talking about spirituality. The belief that there is a higher power that has kept you alive for the 100 days, 100 plus days. You may not have done so many, very few of us have done, very classic things to survive. And we are almost now at par, whether you're rich or you're not, you're wealthy, you have resources, we are all at par in terms of the vulnerability. And the only safety that we're doing is the three basic things, And I think that gives me such confidence that it doesn't matter. And I repeat, the quality of soap is not the issue. The quality of the mask is an issue now, particularly when we are being told, you know, you've got to do the one that is safe. The social the physical distancing, I don't want to call it social. The physical distancing is something we can all do. So the faith and hope is really the very first thing, because that is what removes the fear, the anxiety, because anxiety has made some people really run to hospital. Because even for me, when I was talking about that announcement of the case, you know, you sometimes feel like you're not breathing in the night, and it's like you check, am I breathing? Because the reality has just hit home very close, and a number of people can get into that mode. I really appeal that if you find yourself into those panic moments, anxious moments, and you're also working in a place which is overwhelming, there is need to seek support, and particularly professional support, and in spiritual and in counselors. We have very many counselors and psychologists whom we are already holding a conversation just to be able to step up and support people. And then I would also just, you know, some of the things that would make us have a lot of faith and hope is that when you're blessed with more resources, there is need to find a place, institutions of integrity where you can give back. And you know, when you give back and you see someone is helped by what you have done, it gives you so much, you know, enthusiasm to live. It also gives you a lot of hope, and it also makes you feel like you're very important and you can live because God is seeing that you're doing a good thing, and your family can live because you're doing a good thing. So some of these acts of kindness, I think there are some religious groups that have excelled in these acts of kindness, and then they get a lot of confidence to face the next day because they know that they are doing something for someone else rather than just themselves. Yeah, and of course we know that this season will also come to pass. It passed in China, Gladys. It reduced the intensity. It's coming to a point where we realize that even though something can be so catastrophic, but it still comes to pass.
There's a light at the end of the tunnel.
Yeah.
All right.
It still comes to pass.
Thank you so much, Reverend Lois Snow, who is a counseling psychologist, for all your words of wisdom and encouragement, even as we found out how we are doing and how we can encourage each other during these very unprecedented times. And before I bid you farewell, there's some other stories we'd like to look at across the borders, and more than 80 people have died in recent days after drinking toxic bootleg alcohol in the Indian state of Punjab. Now, according to officials, the people died in 3 districts of the northern state, and police have arrested 25 people. The Punjab Deputy Commissioner says that they will take strict action against the perpetrators and have requested for a proper scientific investigation of the case. Nothing is confirmed yet. The postmortems and police investigations are still ongoing, and the chemical analysis is being done. The excess of spurious alcohol is very strong, and it will take some effort to break it, according to officials. Elsewhere, China's economy may have rebounded sharply after a historic contraction from the coronavirus outbreak, but job seekers face a less rosy situation, with businesses still reeling and household costs on the rise. Now, Mei Jingjing, a biology student, says, I have studied for so many years at school, so I don't want my family to pay for further training. I'm really worried my finances right now and don't know what to do. Now, Chao Jiabin adds, because of the epidemic, my options in finding a job this year is relatively limited because I cannot go out of town, but I'm quite adaptive to different situations, so it's okay for me. Liang Xiongning, a hiring personnel, says the overall situation today is not very good. There are some people, but not as many as we hoped it would be. I feel that there are not many job seekers in general. I see you still talking to us even as we asked you that question of the day, how you are doing in this season. And James says, very candid conversation. Dr. Busire's message was so touching. Thank you for watching, James. Mwajuma Kivuli says, Kenyans, however educated, they are so ignorant. Learn to read and acquire knowledge. Ni hayo tu kwa sasa. Mwajuma, we hear you. We have hashtag the big conversation. Thank you for this show. Lois Noah has really spoken to me and all your other panelists. We need more of such shows. Thank you for watching. And we have Londiani who says, hustling is my business each and every day, and I'm waiting for my God in that hustle. Yes, keep the faith even as we forge on during this season and beyond. Now, this has been a very, very, very informative and very critical show to have even as we started off season 2 of Your World. Again, thank you for your continued support every weekday, even as we try to make sense of a new normal. Now, tomorrow, we focus on the impact of the pandemic on the church, the role of the church in these uncertain times, and what the future holds for religious institutions. Join us then. My name is Gladys Gachanja. Have a wonderful week.
Thank you.